Hi, this is Dr. Jonathan D. Hall coming to you from the North Shore of Boston with another thoughtful patient's guide to plastic surgery. Today I'm going to discuss with you my recommendations to follow after your breast augmentation. Now, every doctor does things a little differently. This is what I've found over the years to work well for my patients. The first thing is to prepare. You want to be prepared for your surgery. Make sure you haven't taken any aspirin, Motrin type drugs known as NSAIDs, fish oil or omega oil for 2 weeks before your surgery. Many people are surprised to learn that fish oil pills and omega oil pills can actually increase your risk of bleeding. So try to stay away from those. Again, no smoking. A single cigarette in the month before surgery has been shown to double your risk of infection. Pretty shocking statistic. So if you are a smoker, we recommend that you stop smoking for 2 months before and after your surgery. And this includes exposure to secondhand smoke if you live with someone that's a heavy smoker. Also, you want to pick a support person for the first day or two. At least someone to stay with you the night after your surgery, and maybe also to help you during your second day. So healing is a process. You should prepare for the emotional and physical recovery by rereading the handout that I've given you describing the emotional and physical reactions that you can typically expect after surgery. There are typical changes in your emotions and energy level after surgery. Surgery affects each person differently, but this is a good start to prepare you. I review what you're going to feel and hear from other people, the expected swelling, and the normal healing process. Now, don't forget to put on your scopolamine patch at bedtime the night before your surgery, or in the morning if your surgery is later in the afternoon. I'll tell you which time to put that on. Most patients typically put it behind their left ear. This decreases your chance of nausea after surgery from the anesthesia. There's a typical side effect of some dryness of the mouth or blurring of the vision, but don't be overly concerned. That goes away after you remove the patch. Now, before your surgery at the hospital, we will pre-warm you in the holding area with a warming blanket. It feels good, like going to the spa. It also decreases the stress of surgery and risk of infection, preventing your body temperature from dropping when you first get to the operating room. I'm also going to have them give you some Tylenol and Celebrex just before going to the operating room. This is part of our Enhanced Recovery After Surgery plan. The letters are ERAS, E-R-A-S. And as it sounds, it helps to enhance your recovery after surgery by decreasing your pain and speeding your recovery. So a good recovery starts with the surgery. The surgical techniques that I've described in another video predictably lead to a 24-hour recovery in most patients. So what is a 24-hour recovery? Well, your mileage may vary, as they say, but I recommend that my patients pick up some over-the-counter Advil to have on hand, and I typically have given you a Percocet prescription as well. Now, Percocet is a narcotic, and it can make you sick to your stomach. If I have 100 patients, one woman will have a lot of pain and need to take the Percocet for a week. 20 women will only take Advil and may even go out to dinner the night after their surgery. And 79 women will take the Percocet and the Advil for the first day or two, and then just take the Advil. And that's pretty typical. Most people by the second day, certainly, if not the first day, are no longer requiring the narcotics. So now Advil, Motrin, and ibuprofen are identical. They come as 200 milligram pills over the counter. I have you stay off of this for the 2 weeks before surgery because of the bleeding risk, but after surgery it's fine. Many people are surprised to hear that in studies of women who had hysterectomies, which is a painful operation, that ibuprofen worked as well to control the pain as morphine. So it's a great pain reliever, and it doesn't make your stomach upset like the narcotics. So we encourage you to try to take that rather than the narcotics if you can. So let's talk about your first 24 hours. So the first 24 hours. After being released from the hospital, go home and take a 2-hour nap. Just 2 hours, no longer. Have your caregiver wake you up and have something substantial to eat, not just crackers. Have something good to eat. Most nausea from the anesthesia would have already happened in the first 3 or 4 hours, and you've slept through this, and you're ready to get moving a little bit. So it may be a little bit challenging to push up with your arms to get out of bed, so just roll to your side and sit up. Most nausea after this point is either from not drinking enough fluids and being dehydrated, or from taking the narcotics on an empty stomach. If you normally have Diet Coke, drink a real Coke or Gatorade or ginger ale, something with some sugar in it, and have something good to eat. After eating something, take 2 of the over-the-counter Advil, Motrin, ibuprofen pills, so 400 milligrams in total, and then repeat this every 4 hours until you don't need it. If you're really having significant pain, that this is not taken care of, and in addition, you can take your Percocet prescription that was prescribed. So the night that you come home from the hospital, it's okay to wash your hair and move your arms around a little. You want to rest the breasts. You don't want to lift more than 5 pounds for at least the first 3 weeks. But normal light activity is okay. You don't want to reach for the top shelf because that can pull against your incision, but washing your hair and moving your arms around is good. Take some more Advil, Motrin, ibuprofen at bedtime. You can also take some Benadryl the first night or two to help with your sleep. When should you worry? Well, rarely. We'll have a patient that has some bleeding inside a breast, dramatic swelling and pain and bruising on one side. It's always on one side and it's always dramatic. If that happens, call. It's not subtle, and you'll know. Don't worry about whether you have it or not, you'll know. And if that happens, we meet you back to the hospital and go back and find that spot that's bleeding. But rarely, very rarely. So the next morning, after your surgery, get up, have breakfast, and after you eat, take 2 of the over-the-counter ibuprofen. Wait about 30 minutes and then take a nice warm shower, not overly hot. You might notice an orange color on your skin from the antiseptic called a chloropep that we use in your skin, and maybe a little bit of a bluish color from the surgical marker. I'll have a clear plastic patch over your incision called a tegaderm that protects your incision. It can stay on for the first 6 days. But if it bothers you, or if the gauze gets wet underneath, simply pull the plastic off. It'll come off with the gauze, and leave the steri strips on underneath. They can get wet in the shower. Just don't use a body wash. We found that if people use body wash, it soaks into the tapes and cause irritation. So Dove soap, bar soap, or Cetaphil is very helpful. So your plan for the second day, do some light errands, walk around the mall. You can drive a car if you're not taking narcotics, but expect to run out of energy around the middle of the day and allow time for rest as you recover from the anesthesia. And repeat the Advil every 4 hours as needed. Now, your breasts are going to feel tighter and more swollen at the end of the day. And you may also have some swelling in the stomach area. So after surgery, we retain fluid, and the swelling generally increases for the first 3 days, peaks at 3 days, and then starts to decrease. It's also normal to notice some soreness in your ribs and lower back. This fluid that you accumulate in your tissues after surgery will start to come out in your urine after the 3rd day, and you'll generally lose that bloated feeling in 5 to 7 days. Now, some people ask me about homeopathic treatments. There is an herb called Arnica montana that can help with mild bruising and muscle soreness. Little pills you put under your tongue twice a day. And bromelain is a pineapple extract that might help with swelling. These aren't essential, but if you want to try them, go ahead, and some patients find these to be helpful. Sleep however you're comfortable. The support bra that you're in will protect your incisions. So you've gotten through the first 2 days, and so for the first 6 weeks, the main idea is to rest the breasts and protect your incisions. So even though you feel good, your incisions are weak. So this is not a no pain, no gain. Also, in the first 2 to 3 weeks, if you were to really strain or do heavy exercise, a blood vessel inside the breast could open up and cause a hematoma. Again, not common, but could happen. So you really want to avoid lifting more than 3 to 5 pounds in the first 3 weeks. The most important thing also, again, protect your incisions till they're strong. So we don't have you wear an underwire bra that can dig into your incision, and no reaching for the top shelf that might overly pull against the incision. But most light activity is okay. Everyone asks me about sex. I think it's really best to wait 6 weeks until you're healed. If you try to do too much too soon, you can cause pain and be in pain for even longer and lengthen your recovery process. So don't push yourself too much. Also, if you stretch too much against the incision, not only is there a risk of a hematoma, but the scars can widen. Rarely the incision can open and you could lose the implant. These things are rare, but you don't want to be the one to have a problem that could have been avoided. So if you live nearby, I'll see you back in the week after your surgery and change your tapes. For my patients that come from a distance, I'll have you remove your steri strips in a week or 2 and begin micropore taping. Now, micropore taping is really one of these great things. It works fantastic and it's inexpensive. I would only buy this particular brand, which is made by 3M. There are other types of tape are usually too irritating to the skin. This tape seems to be identical to the steri strips that 3M makes, and it's very, very well tolerated and inexpensive. It's maybe $2 a roll. I don't have any financial interest in the company. So I'd like to have a look at this graph a little bit on wound healing. And basically what this says is that early on, your incision is being supported by your sutures, which are getting weaker and weaker and weaker and gradually the incision starts to heal and starts to get stronger, but your incisions really aren't strong enough to take any force for about 6 weeks. In fact, they're at their weakest about 3 weeks after surgery. So if you're doing too much in the first 3 to 4 weeks, that's when the incisions can open up. So I'm going to have you change this Micropore tape every week or so for the first 6 weeks. Now, if you develop some leakage under the tapes, fluid, danger, you're doing too much. That means the incisions separate a little bit and some tissue fluid's leaking. So you want to leave the tapes off and use Aquaphor and a gauze pads. And Aquaphor is a bland ointment that's available in the pharmacy in the moisturizer section. So if you do have this little separation leakage on the tape, that's usually at the 3rd to 4th week when your incisions are at their weakest. You can still go ahead and heal well, but be very careful. Your scars will spread a little bit more. If you disrupt the inner layer of sutures, you could lose the implant. I have a friend who's a plastic surgeon in Florida who has a nurse who went out and did landscaping work the weekend after her surgery, and her incisions opened up and she lost her implants. I have my first patient who has ever had an infection losing a breast augmentation implant last year, a nurse who is left-handed, and on her left side she did too much after surgery, and her incision started to open, and she kept doing too much, and her implant ended up getting infected, and we had to leave it out for 3 months, and then replace it. And well, again, I don't want to sound like a broken record, but rest your breast for 6 weeks. That's probably the most important part of this whole video. So after 6 weeks, no restrictions except for sun exposure. Sun can come through a thin bathing suit, and if you're someone that tans easily, the scars can darken in the first year or so. We call this post-inflammatory hyperpigmentation, or PIH. If you've just had a breast augmentation, it's hard to get enough sun on your scar. What about massage? Well, it depends. A lot of patients say, should I massage my breast after surgery? Well, in the past, we thought that capsular contracture could be avoided by moving that implant around and keeping it loose in the pocket. And we found that that's really an old concept of what causes capsular contracture. Please see my video of the methods we now take to reduce your risk of capsular contracture. And if we use a textured implant to decrease shifting of your implant after surgery, then you really don't want to be moving that implant around because we want the tissues to adhere to the implant. But light massage may be good. So the psychologists say that when you move into a new house or apartment, it takes 21 days before it feels like you live there. And breast augmentation is a happy change, but it's still a little bit of, my gosh, where did these come from? It doesn't feel like me. And so light massage, you do your own massage, not your boyfriend or significant other, but you're doing your light massage. That helps the breast to be less tender faster and feel like you faster. So a light massage, I think, can be a good thing. So after the 6 weeks, really, most important thing is scar modification. So if the Micropore tape is working well, then continue it for 6 more weeks or so until you're happy with how the scars look. Or you can change to silicone pads or silicone sticks. The scars continue to fade over the next 12 to 24 months. Average patient, first 3 months is enough. Some people, you want to wear this longer until we're happy with how the scars are. So scar healing is interesting science. So scars get thicker for 6 weeks, and then they generally flatten and get better for 2 years. But some people, their scars get thicker and thicker. And if we can look under the microscope, there are fibers going everywhere like a Brillo pad when the scar is very active. And then that starts to become more organized and look more like a piece of fabric as the scar matures and gets better. So there are things that we can do to help that scar to improve and get better. Of course, there's a genetic component to healing, and we can't change your genetics, but good scars do start again by resting your breast for the first 6 weeks. You don't want to exceed the strength of your sutures before the scars are glued back together with the healing process, because otherwise the scars can start to widen and become thicker, even if they don't open up. But we can also modify the scars early on. One of my professors when I was at Washington University in St. Louis, Dr. William Monifo, showed that burn scars are improved by silicone sheeting. And he would put a silicone sheeting on half the scar and show that that half got much better, and the half that didn't have the silicone sheeting did not. Later it was shown that silicone wasn't absorbed. It was a surface phenomenon where the smooth surface of the silicone triggered the thickened scar to flatten faster, again changing that Brillo pad into more like woven fabric. When I was doing a fellowship in craniofacial surgery in 1989, I conversed with a pediatric plastic surgeon from Taiwan that was using Micropore Tape and found this worked almost as well as silicone for his patients. And again, it's interesting because Asian patients tend to have more problems with hypertrophic scarring. So I've been using Micropore Tape in my patients ever since. So the silicone sheets seem to work the best, but there's more of a fuss around factor. You have to take them off when you shower or exercise and then replace them. But if you're someone who is prone to thicker scars, typically my Asian patients, or you want to pull out all the stops and do everything to make the scars absolutely as good as they can possibly be, then you should use these. And the silicone comes in strips and in shapes. So if you've had a breast augmentation, just a strip is fine. They sell these at CVS, Target, Walgreens. But if you've had a mastopexy, the shapes can be good. But if you're very active when you exercise, starting 6 weeks after surgery, of course, it might cause some irritation, and the silicone strips or sheets might work best for you. So a new product that my patients really like is a chapstick-like form of silicone that's easy to use. It's called ProSil by Biodermis. I don't have any financial relationship with any of these companies. You can Google them and buy it online. You simply put a thin layer over your scar twice a day. It doesn't seem to be quite as effective as the silicone strips, but it's much easier to use. It seems to be a little bit better than other liquid forms of silicone that are out there, which kind of peel off. And my patients really seem to love it. So we've been recommending that to our patients over the last year. So again, most important, rest the breast for 6 weeks. So that doesn't mean you can't do normal light activities, but don't strain your incisions. So again, timeline, prepare for your surgery, get ready for your surgery, protect your incision for 6 weeks, and modify your scars afterwards. So long term, dental prophylaxis is controversial. So you'll see in my capsular contracture video that the most important thing is keeping bacteria away from your implant. So we keep the bacteria away from your implant before the surgery and during the surgery. And after the surgery, if you go to the dentist, bacteria can get into your bloodstream from your mouth when you're having a cleaning or dental work, and it can go through your bloodstream and settle on an implant. So if you have a hip replacement or a heart valve, the cardiologists and the dentists are going to recommend giving you antibiotics. Nobody's really made a formal recommendation for that for breast augmentation patients, but I recommend that my patients consider taking a single dose of antibiotics orally just before dental procedures or dental work. So if you're not allergic to penicillin, 4 pills of amoxicillin 1 hour before. If you are allergic to penicillin, 2 pills of clindamycin, and that's it. So you have to balance the risk of taking the antibiotics, which is low and not zero, versus the risk of getting a capsular contracture. But I can't prove it, but I've been recommending this to my patients for years, and we have an extremely low rate of capsular contracture in my practice. I also recommend that you not have a tongue, nipple, or a genital piercing. Other piercings are fine, ear piercings, belly button piercings, but if you have a piercing in your tongue or an area of the body with bacteria like the nipple or genital area, a little bit of trauma, that bacteria can get in the bloodstream and can shower your implant with bacteria. And so I've had patients in the past, before I knew better and told them not to wear these things, that were getting capsular contractures, and I think they're related to the piercings. Finally, implant surveillance. Implant surveillance is controversial. The FDA recommendation is to get an MRI 3 years after surgery and every 2 years after that, but MRIs are expensive and they can have a false positive rate, falsely show that you have a rupture 10% of the time and lead to unnecessary surgery. Dr. Brad Bengstrom from Grand Rapids, Michigan is a plastic surgeon who's shown that high definition ultrasound might be the answer. He can pick up ruptures in implants with this. The rupture rate probably, in most studies, if you put everything together, is around 8% at 10 years of implants may have ruptured, and then going up slowly after that. More patients than not will probably get 20 years or so out of their implants. Again, we can't really say. But I recommend that my patients go and have an ultrasound of their breast at the time of their mammogram, 9 years after surgery. Why 9 years? Because the warranties that the 3 implant companies in the U.S. have generally run out at 10 years. And so if you were going to pick up a rupture, better to pick it up at 9 years than just after your warranty expires. So this is Dr. Jonathan D. Hall, again coming to you from the North Shore of Boston with a thoughtful patient's guide to plastic surgery, and these are the recommendations that I recommend my patients follow after their breast augmentation to have a successful result. Thank you.